think about Jim's important contributions, particularly in the realm of healthcare, to this community, I think you have to go back to pre-1995, before Jim Barba was the leader of the Albany Medical Center, and what position the medical center was in then and what position it's in now. And I think it's most extraordinary.
I never thought when I started in this position that I would be in the business of building buildings. But if you look around all up and down New Scotland Avenue and certainly elsewhere throughout the region, there are Albany Medical Center buildings physically present.
My concern was this area in the city when I took over was probably the highest crime rate of anywhere. And I said, we have to attack that, and what we have to do is develop and take care of the properties that are there, work with Albany Medical Center. I mean, you got a beautiful, beautiful hospital right here with thousands and thousands of employees, many of them from the city. And I said, they can really make a difference, and we can make a difference for them.
A point of personal pride for me is Park South. We decided, with the help of the board and our partners at Tri-City Rentals, the Massery family, a number of years ago to deal with that. And we created the Park South development. Over 250 beautiful residential apartments, a new medical office building, a parking garage to accommodate all of that growth.
It really has had a very positive impact on this neighborhood, on the people that live here, on the people that have moved in. And if you walk around and look at it, I mean, Jim cared, yes, about this hospital. This was his #1 priority. But he also cared about the positive effect it could have on everything we're trying to do here in the city. And his latest accomplishment, the pediatric emergency room, something that he really fought for and we discussed probably for 15 years. And I was so happy to see that come to fruition and really become another anchor for a great medical institution.
That had been a dream of mine when we opened it for 8 years. I had a nurse who works here say to me just yesterday that her daughter, a child, needed to come in emergently about a month ago. And it was discovered that she had a brain issue that required immediate brain surgery to save her life. But we saved her life. But it's just so much gentler for children to be in an environment, especially when somebody is that ill, to be in an environment with just children around.
I think he's used his role at the Albany Medical Center to really enhance the quality of life we have in this region by providing really a world-class academic medical center.
I started working for Jim Barba in 2001, and I will tell you he has not wavered 1 inch from being a staunch and ardent advocate for all 3 parts of our mission as an academic health science center. So we're the only academic health science center in upstate New York for a 120, 130 mile radius. And Mr. Barba has been clear. We will support the missions of the medical center. Education, patient care obviously, and research or discovery. So he has been incredibly supportive of the missions of the institution and has made sure all of us in our leadership roles pay attention to delivering those services to this region.
Without Albany Medical College, there is no Albany Medical Center. I like to say at the college we manufacture physicians. Every year, approximately 140, mostly young men and women, graduate with their MD degrees. But those 140 men and women who get their MDs every year remain, in some respects, right here in the region. So we are replenishing the supply constantly. So if you look at the college, whether it's that we attract good physicians or we make good physicians or we do research and cure diseases, without the college, all that goes away. And if it goes away, what we have in the hospital is just a big hospital, a big community hospital. I'm not sure this region needs another big community hospital. We do need what we've got, an academic medical center. And the reason we're academic is because of the college.
When I think about Jim, what comes to mind is a leader of leaders. And by that I mean when you look at the impact that Jim has had, and more so the impact he's had by the people that he brings together, I think that's what makes Jim special. And whether it's the work that he does at the medical center or work like helping the Northeast Kidney Foundation, He's someone that is deeply committed to bringing people together that care. And a night like tonight shows when you bring together people that care and you have a leader like Jim, really special things can happen.
Our programs in nephrology, in organ transplant, specifically kidney transplant, cannot exist by themselves without outside support. We need the support of the Northeast Kidney Foundation in order to continue to do it successfully.
The Northeast Kidney Foundation is fundamentally important to this region. First and foremost, patient awareness. So letting patients know about kidney disease, what they need to do to mitigate kidney disease, and how to stay healthy and avoid kidney disease. Secondarily, policy and advocacy. So the Kidney Foundation is very, very important in advocating on behalf of the patients with current kidney disease and helping our politicians in Albany understand what needs to take place in support of those people. Thirdly, education. Healthcare providers, new, mid-career or old career, have to keep up with what's happening in the evolution of treatments for kidney disease and medications for kidney disease, and the foundation has been fundamentally important in making sure we roll out those programs.
It has a role in patient education, a tremendous role in supporting families through the very difficult times of kidney disease. That support that an organization like the National Kidney Foundation and the Northeast Kidney Foundation provide to the people of this region is essential to provide adequate care. It's not only the care that we get from our traditional healthcare providers, as good as that is and as important that is, but it's really the support services that an organization like the Northeast Kidney Foundation can provide to the patients and the families that is profoundly important.
The Kidney Foundation doesn't just take money and advertise, they take money and invest. They invest in people, they invest in product, they invest in a lot of things that are going on, and we really can be partners with them. And I ask you all to continue support, not just tonight, but throughout the year for the Kidney Foundation. It really has made a difference.
So I think it's critically important that, when we have organizations like the Northeast Kidney Foundation, that the community rally around them and embrace them and make them an important part of how we grow this region, in a comprehensive fashion to meet the needs of everybody that's really, really fortunate to be part of it.
Jim, congratulations on receiving this award, well deserved. It's wonderful to see you honored this way and everything you have done in leadership at the Albany Medical Center. And let me also congratulate the Albany Medical College, who's also receiving this award, and Dean Vincent Verdile.
Jim, I'd like to congratulate you on your continued success, and more important, thank you for all that you do for our region and all that you've done tonight for the Northeast Kidney Foundation. Without leaders like you, things like tonight can't happen, and it's really, really important, and I think the room and the Kidney Foundation should be very grateful for all you've done to support this important cause.